Hi, everyone. Welcome back to the Hello Fam podcast. I'm your host, Shalini, and I'm excited to have you all here with us today. We hope you all are continuing to enjoy the podcast, as well as the small snippets we've been uploading to all of our various social media platforms. And to stay up to date on our latest features on the app, please make sure to follow us on LinkedIn, Facebook, and we're also available on social media sites such as TikTok, Instagram, and YouTube at hellofam.app. Now, back to the podcast where we talk to longevity doctors, key opinion leaders, and others onto their views into longevity. Our goal is to provide you with greater insight into the world of living long and well, as well as learn some practical tips to incorporate into your daily lives. Join me in welcoming today's guest speaker, Dr. David Feldman. Hi, Doctor. Welcome to the podcast.
Actually, thanks for having me. Wonderful to be here.
Yeah, thank you so much for taking the time out of your busy schedule to meet with us today. So, starting off, can you give us a little background about yourself, how you got to medicine, Hello Fam, as well as any of your hobbies and interests?
Sure. Let's see. So, David Feldman, I'm a physician. I'm an ER doctor, actually. Been practicing for about 20 years. So, the topic of longevity, wellness, and healthy longevity is important for me, both professionally and personally, as I start to approach, how to really make sure that I have healthy and quality longevity in my life and my family, my loved ones. For me, becoming a physician is, in fact, I'm blessed to have, be married to my wife and three children. I was just talking to my youngest one at one of our bedtime chats about, how I became a doctor. And for me, it was always something I just wanted to do before I can even remember. And so I guess it's sort of a calling for me. And I've been fortunate enough to become a doctor and feel that it's been exceedingly rewarding for me personally. So love being a doc, love helping people. And that's a little bit of how I sort of fell into it. In terms of me personally, I spend most of my time, with family, my wife, my three children. There may be a picture in the background here. And then also we're blessed to still have both of our sets of parents. And so my children have both sets of their grandparents that are pretty close by. One lives 5 minutes away and one lives just a couple hour drive away. So we see them a lot. So family is very important. Time with them, work. I do enjoy work, and so I do work a good amount. And then when I do get a chance to, do other hobbies, I try to work out a little bit, try to play golf a little bit, and just, try to have some fun. We're actually incorporating more travel. Well, I've got my kids now are 10, 12, and 15, and so travel's become a really fun hobby for us when we can do it.
Yeah, that's wonderful to hear, and I'm really glad to see that you guys are branching out in all aspects of longevity.
Yeah.
So let's go right into discussing that, which is Hello
Sure.
Fam's mission.
Yeah.
So starting off, what is your definition of longevity and what does it mean to you?
Yeah, so I looked up the definition of longevity sort of as we were talking about doing this podcast, and it refers to, I guess the definition I found was longevity refers to the length of time that an individual lives, the duration of life. But what I think most people think of when they think of longevity, and certainly when I think of longevity, I think of a healthy longevity, like living long, incorporating very much in parallel or very similar to the concept of wellness. But I think longevity actually has become wellness is very important, and it's a very important topic that we live through. HelloFam addresses that through through your platform, which we appreciate. In fact, health and also Vituity, wellness is super important. But I think the conversation is starting to turn also toward longevity, which I think is similar, but a little bit of a different sort of mindset. And to me, and I think to most people, they think of sort of healthy longevity. And so if you expand on that definition, it's all the key factors of sort of it's a healthy life, which leads to longevity, right?
Yeah.
Balanced diet, regular exercise, social connections. To me, a big part of longevity actually is when you're fortunate to have multi-generational connections. That contributes a lot. And I think a lot of the research done by experts. By the way, I'm not necessarily a longevity expert, but I'm very interested in the topic. But Peter Tia and some others who look at blue zones and other aspects of longevity, and those who make it to like 100 years of life and beyond. There's a lot of science behind it, and the multi-generational part is a component of that. I'm actually blessed to have some good genes in my gene pool. I'm half Japanese, and I have multiple family members that live to over 100 years old. And so hopefully that I incorporate some of that into my longevity. But, social connections, mental stimulation, wellness, stress management, those are all parts of the definition of longevity that I think are important. exercise, diet, time for these aspects, and then also quality sleep, I think to me are key components of what the definition of longevity is a part of.
Yeah, and I think you have a very unique perspective coming in, as you're saying, genetic-wise and a multi-generational family. It is nice to have that comprehensive overall look and drive into the idea of living long and well. And also moving on to our main topic, you have a particular interest in health economics, which is a very
Yes.
convoluted topic, hard to understand, and there's so many facets to it that gets tiring or confusing over the years. So starting off, considering healthcare, housing, and daily living expenses, what are effective ways to prepare financially for longevity without compromising quality of life?
Yeah. So again, just a little disclaimer: I'm not a financial planner. I'm not a
Mm.
financial expert, and I'm not here to give investing advice per se. I'm actually, if anything, actually, finance is an area that in some ways is a hobby and a passion for me. I actually have strong interest and a background educationally in economics, and did college work on that, and also have, in addition to my MD, I have an MBA with a focus in finance, and so that's always been an area that I've been passionate about and I find fun. I like numbers. But in terms of longevity and making sure that you have the financial preparation for a healthy longevity, healthy long life, there's a number of key aspects to that. In terms of preparing, it's actually not that. It's pretty straightforward, and a lot of things that you can find in a lot of sources. I have a couple sources that I'm happy to share. No conflict of interest, no financialism, these things, just resources that I found make a lot of sense to me. But if your question is preparing, right, for longevity
Mm.
and how you can best do that, it starts with some basic things. And these are practices and aspects that I've studied over the years and always continually sort of reinvigorate as in periods of time, like at certain points of your life, you sort of refocus on these things. But I mean, I think it's as basic as creating a budget, understanding sort of that you're prioritizing saving for the future. And the sooner you do that, the earlier you do that, the better for your future because of the power of compound interest, which is actually pretty powerful. You don't have to win the lottery or have some huge windfall if you just steadily save and have steady investments that build over time. It actually is pretty powerful over a number of decades, which is sort of what you're saving for in terms of later in life. There's a concept in a book that I really like because it's actually really simple and straightforward by Robert Kiyoshi called Rich Dad Poor Dad. There's a book that I read in my youth and it's really well known and a lot of folks know that. But there's a concept in there, pay yourself first, which I really like. And I try to stay disciplined because I very much have someone who enjoys, spending money. I'm not just always saving, but becoming a disciplined saver is important. And if you always make sure out of your paycheck every month, you take a certain amount out and you pay yourself first, which is invest it in the future and then live off the rest. I think that's an important concept and pretty powerful. I think other aspects that you can do, which I think sort of along the lines of the questioning, and please interject, is, in addition to a budget, paying yourself first, having an emergency fund. General rules of thumb, which aren't my rules, but I've learned is, when you can have 6 months of savings based on your income. So the equivalent of 6 months of income in savings for emergencies that come up, whether they're healthcare related or other things, is helpful. And then starting to save early with, retirement plans, 401k, health savings accounts, flex savings accounts. Those are very important to participate, especially when there's any type of employee match. You want to take advantage of those, or any kind of tax deferral. Also,
Yeah,
within those lines, Roth IRAs are really great too.
yeah. And then on the opposite end of that, what are some common misinformations or misconceptions that you've come across about the economics of living long?
I think that a couple things, and something that I fight all the time with myself personally and my family budget and trying to pay myself first is, oh, there's plenty of time for that. Like I can
Mhm.
spend money now on something that may be a nice to have or something that's just, kind of an impulse buy because I have that tendency. Like a lot of people, I definitely have that runs in my fabric of my person. But that, it's something that you don't have to worry about till later, and that you can save when you're older, which actually saving when you're younger is the where you want to prioritize it. I recently
Mhm.
read an article that said, if you can live how others won't live now, meaning that if you're very financially disciplined and you actually save more than you spend, so you really are pretty frugal, then you'll be able to live how others can't in the future, meaning that you'll have more of a nest egg to live off of. And I think that's really important. Some other misconceptions are that, like, healthcare costs are always going to be really high and that they're going to be overwhelming in as you get older. That's not necessarily the case. I think if you actually invest in not just investing in the future with your dollars, but investing in your health for preventative care, good habits, good healthy balanced diet, exercise, those all contribute to financial security and healthy longevity. And then some other misconceptions that I've looked into recently is, how much will Medicare really pay for me when I'm older? How much will Social Security cover? And actually doing financial planning, which I think is a very important thing to do at as early as possible. And there's different levels of financial planning that you do early in life. Maybe it's just when you're single, and then when you're married, and then when you have children, or you have, parents that you need to care for. Those are different layers of sort of financial planning. But the sooner you can do that, and sometimes it's just really simple, like creating a budget and starting to save and taking advantage of the programs you have through employment or for yourself. And then I think what's interesting too is that I came across a concept a few months ago that there is a perception that, everyone should retire early. But actually, when you look at longevity, mental stimulation and having a purpose, the Japanese call ikigai, which is something I learned through Blue Zone research and Peter Thiel's work, especially in Okinawa, um, sort of tells me that as long as it's okay to work actually later in life. And sometimes if you retire too early and you're not mentally stimulated, you don't have a purpose, that can actually go against your longevity. So, and then you continue earning money and you can keep saving, which is sort of an interesting concept that I
Yeah.
really resonated with me.
Yeah, I've seen research into it that talking about how the effect of a sense of purpose can actually have a profound impact on your longevity, and having that intrinsic and extrinsic motivation towards achieving something, whether it's something small as in creating a wonderful family or just going maybe hiking Mount Everest, something that you're working towards
Yeah.
helps people propel them forward and feel
Right.
better and have that, I guess, emotional relevance to longevity. And I
Oh,
guess yeah.
no, no, go ahead.
Yeah, that was what I was going to say.
Oh,
And you briefly touched on this as well, but the idea of healthcare costs increasing, how would the cost or how does the cost of comprehensive healthcare increase as you age? And what financial planning strategies are you implementing to mitigate these costs?
yeah. So speaking um, for me personally, my family, and again, not as a financial planner, but yeah, costs go up. I mean, as you get
Mhm.
older, there are healthcare costs that go up. You do need to invest and maintain your healthcare. So, good insurance, health savings plans, uh, um, funds that not just emergency funds, but there are long-term care insurance plans that you specifically can sign up for. And the younger you sign up for those, the better. The other
Mhm.
thing is with insurance. Insurance can actually be quite a bit of your budget every month because we get insurance for all kinds of stuff, right? Houses if we were fortunate to own a house, cars when we have cars,
Mhm.
life insurance and things like that. And so some of the goals of saving is so that you can save enough so that you actually don't need that insurance in the future. But definitely having life insurance, like term life insurance, long-term care insurance, those are great insurance plans to have for unforeseen, changes in your life situation. Um, but I think those are the things that I'm definitely looking at and trying to manage. And then it names starting early, but then also constant maintenance. Disability insurance is also one. And the goal is that you have it for the period of time you need it. But if you can save enough money, then you can scale back those things because their monthly premiums or costs.
Yeah, and going along with that, what are the main economic burdens faced by the older generation? And do you see telehealth, which is a more field that's emerging in healthcare, playing a role in reducing or easing these costs and burdens?
Oh yeah, absolutely, absolutely. So, as you age, there's just realities. It doesn't, the misconception that it's always going to be more expensive isn't necessarily true because if you can age and live a healthy lifestyle and then stay free of chronic disease or any, even more debilitating, diseases that can happen like cancer and other
Mhm.
conditions, healthcare costs don't have to necessarily rise because then it's preventative care, it's maintenance of care. Telehealth certainly helps with a lot of the aspects of cost and access, both throughout our entire lives. But I think as you age, there is a reality that increased healthcare, you'll have increased healthcare needs. There's increased healthcare screening and tests you can do, but then there's also things that just will come up that's why it's important to have the insurance and emergency funds and additional funds so that you can have that financial security. Because really for healthy longevity, the financial security then leads to mental security, security with housing, access to healthcare. And so having that is just a reality that then that gives you the peace of mind to maintain wellness and quality longevity. But you'll have increased needs. With those increased needs, costs will go up, and so you have to be financially prepared for that. Long-term care is a reality. As you get older, you'll have to move into situations where there's more support, either by your immediate family and sometimes beyond the immediate family. And like as you get older, senior living communities offer a lot of these aspects, independent of your immediate family, which is actually beneficial too. And then things like transportation and scheduling assistance and these logistical aspects just go up as you get older, especially when you get to a certain age where you're not driving as much or driving is more challenging. So transportation, making it to appointments, and then also having the time to do those things so that you don't have to trade off. Well, I can't afford to miss work because I can't afford to go to an appointment. So those are some of the things. Hopefully that answers the question.
Yeah.
Yeah.
Yeah. And then we are near the end of the podcast. So I have about two final questions for
Okay.
you. One, what piece of advice would you give to every person out there? And what are your top 3 tips to saving well and to live long?
Okay. Let's see. So the first question was how to best prepare for the future.
Yeah, more like what resources, books,
Yeah.
podcasts, etc.
Yeah.
would you recommend to get a deeper understanding of health economics?
Yeah. For me, actually, that book I mentioned earlier, Rich Dad Poor Dad, is a great book because it's very simple. There's some very fundamental principles in there that I've been able to benefit from because I read it, many years ago. But start saving early, pay yourself first, and make some stable, sound investments. And again, not being a financial advisor, but meeting with a financial advisor. I feel strongly that you should meet with a financial advisor who you actually pay a fee to rather than a commission base, because then I personally feel like then they give you advice and recommendations maybe that are really for your benefit rather than for them trying to get a commission. But meeting with a financial advisor, setting up a plan, setting up a budget, making sure you pay yourself first and save. I think that's the sooner you can do that, the better. The other thing is that if you haven't done it yet and you're a certain point in life, it's not too late to start. You can always start today to become more disciplined, budget, save, and then start prioritizing that. And starting today is better than starting tomorrow. And so I think that to me is maybe one of the most critical things. And then when you start to build that financial, stability and peace of mind, because you know that you're taking care of it and continually maintaining it, then in a sense, you can afford the time to adjust all those other aspects, which I think are critical to sort of health and longevity. And then in terms of sources, I think there's a lot of great sources out there. A few books that I really like. I like the work that Peter T has done on blue zones and longevity. Obviously, I'm a fan of Robert Kiyosha and the books that he's written. I'm sorry, I mispronounced his name. Let me just double check the spelling. But in addition to that, books on healthcare, economics of healthcare, health economics, and healthcare handbook. Actually, the healthcare handbook is a nice one by David Elizadale, who I always mispronounce his name, but I actually think that's a really great book. And then Health Affairs Podcasts and Healthcare Guys are 2 nice podcasts that I think are actually easy to access and pretty well organized. And then there are some other books if you're interested in just for personal finance, like Total Money Makeover, Your Money in Your Life, things like that. But Robert Kiyosaki is actually the author's name. I may have mispronounced it for Rich Dad Poor Dad. If you pushed me on one book to read, I would say for me personally, that's been one that I really feel like I've read a few times over the years. That's been super valuable.
Funny enough, I have that book on my bookshelf. I just haven't had a chance to come around to reading it yet.
You need to
But
read
now
it.
that you said it, I think I will definitely go ahead and pick that up right after this. But
Yeah.
well, that's all the questions I had for today. Thank you so much for coming out and explaining and giving your full understanding of health economics, one as a healthcare practitioner and someone actually implementing these strategies. I definitely think it's been very insightful for me, and I hope also for our listeners. So thank you, Dr. Feldman, for coming out today.
All right. Well, thanks for having me. Enjoy the time.
Thank
Thank
you.